Alright, hello guys, welcome back to my YouTube channel. If you're new here, please subscribe, hit the notification bell so you're notified every time I post a video. And if you're a returning subscriber, hey, you're most welcome back, and thank you so much for supporting this channel. So for those that are new in this channel, reconcile the word of God with medical sciences, and today we'll be talking about a very interesting topic. Yes, we'll be diagnosing a patient all together, step by step. And yeah, I don't want to go straight away to mention the diagnosis of the patient, but because I want us to do together. However, we'll be talking about the patient, or the little boy that the father came to Jesus saying that, help my son, for he's a lunatic. And then this particular man is also associated with the statement, I believe, help my unbelief. It's one of the statements that I find in the Bible very interesting. Yeah, very interesting and conflicting at the same time, because to me I was like, okay bro, what should we help you with? You say you believe and you're saying we should help your unbelief, so which one are we helping? But yeah, that's what it's. But yeah, that father that came to Jesus and he was like, if you can, and Jesus was like, if I can, well, if you believe, all things are possible. And yes, Jesus cast out the spirit from the boy and he got well. However, in the medical field, how would we tackle this? Yes, Jesus has the power to cast out demons, to cast out any kind of sickness just by saying a word. However, in the medical field, we of course have a protocol that we follow to just make sure that we know the underlying issue, we know what's going on with the patient, and we actually try to give a solution. Of course, not a perfect solution like Jesus would give, because the guy was healed at once. However, in the medical field, we have things that might actually just improve the quality of life of the patient, and this is what we'll be talking about in this video. Yes, so this particular patient, I'll be calling him a patient because he's our patient. Yeah, this particular patient is mentioned in the book of Matthew chapter 17:14, also in the book of Mark 9:14 and Luke 9:38. Yes, and I want us, the reason as to why I want us to read all the three accounts is because of the limited information that is in the different accounts. Yeah, the book of Matthew might not give us all the information that we need to give an actual diagnosis, and also Mark might not give us all the information, and Luke might not give us all the information. So we need to get part of the information from all of them and just come up with that right diagnosis for this particular. I'm excited. Yeah, for this particular patient. Yeah, so we'll start from reading the book of Matthew chapter 17 from verse 14. Yeah, Matthew says the demoniac. Yeah, that's how he titled it. And sorry guys, I'm reading from the book from Amplified. I don't know if I should get the Christian Standard Bible also, but yeah, I'm reading from Amplified. I'm reading from Amplified. So the Bible says, let's just go straight away to 15. It says that 17 to 15, that Lord have mercy on my son, for he is a lunatic. Now that's very important information to take, and suffers terribly, for he often falls into the fire and often into water. And I brought him to your disciples, and they were not able to heal him. And Jesus answered, you unbelieving and perverted generation, for how long shall I be with you? For how long shall I put up with you? Bring him here to me. And Jesus cast out the evil spirit from him, and he was healed instantly. And yeah, that's the only information we have from the book of Matthew. So the only information we have right now is that he was a lunatic. His father described him as a lunatic according to the Amplified translation of the Bible. However, we're going to look at what Mark recorded. Yeah, what Mark recorded. So at this particular point, this is the part of medicine where you're asking the patient questions. When did this start? How does it make you feel? Whenever it's there, what do you do? How do you help yourself when in this matter? Just questions that could actually help you get a good diagnosis for this particular patient. Now, because we do not have the patient right here with us, we're just going to see what these writers actually recorded. Yes, and yeah, Mark 9:14. From 14, he says it's titled as all things possible. And instead of starting from 14, we could start from 16, where it says that, and he asked them, what are you discussing with them? And one of the crowd replied to him, "Teacher, I brought you my son, possessed with a spirit which makes him unable to speak." Matthew says lunatic, Mark says unable to speak. And whenever it seizes him, intending to harm, it throws him down and he foams at his mouth. So how many complaints do we have? First of all, we know that he becomes a lunatic. Secondly, he's unable to speak and he foams at his mouth. That's very important information. And then Mark continues to say that to record and say that, and he grinds his teeth and becomes stiff. Very important information as well, which we will use. And then it continues because in verse 20, we'll just jump on Mark 9:20. It says that they brought the boy to him. When the demonic spirit saw him, immediately it threw the boy into an immediate convulsion, falling to the ground, and it began rolling and foaming at the mouth. So when this boy sees Jesus Christ, he starts foaming. He starts foaming. And yeah, that's also important. He goes under convulsions. That's important. Now we have another medical term there, a convulsion. Very, very important to note down. And I think, yes, Jesus asks a very important question, because I already mentioned earlier that in the medical field, we ask questions. We get our solutions from the questions that the patients give us. So that's why it's important to actually give the right answers to these questions whenever you ask, because they're just trying to find help for you. They're not asking these questions to incriminate you. No, just to make sure that, okay, the solution you come up with is actually correlating with your complaints. And Jesus asks in verse 21, Jesus asked his father, "How long has this been happening to him?" I loved this question when I was reading this portion of the scripture. I loved the fact that Jesus asked, because when you talk about seizures, they're just like abnormal synchronous electrical activities that occur in the brain, and they can have an outward manifestation. Now, seizures do not have to go for a long time, you get, but this question is important in that when of course other translations speak of this particular disease as epilepsy. Now for epilepsy, it should occur for more than 5 minutes, number one. Number two, it should be recurrent, like it should occur over and over again. Now of course, you cannot have a seizure for a few minutes and then it has never happened again in your life and you think, okay, I think I'm epileptic. No. So this question was important in that it just showed us that, okay, this boy has been having this kind of seizures from his childhood, and we are right to actually name it a particular kind of disease, which we'll not mention now. Well, I already mentioned it somehow, but if you didn't, yeah, I did kind of. So I found this question very interesting because it's going to help us a lot to actually give the diagnosis. And let's just continue to look what the book of Luke says concerning this particular matter. Yeah, Luke 9 we'll read from 39. It says that, and a spirit seizes him, and suddenly he cries out, and it throws him into a convulsion. So the account of Luke repeats the convulsion that was mentioned in the book of Mark, so that he foams at his mouth, and only with difficulty does it leave him, molting and bruising him as it leaves. I begged your disciples to heal, but they could not. Yeah, so the book of Mark also doesn't give us much information, but however, the book of Luke doesn't give us much information, but the book of Mark has given us most of the information. And it's at this point that I asked myself, I was like, okay, Dr. Luke, what happened? What happened, Dr. Luke? You're the detailed guy. Like, how come we didn't have enough information on this particular thing or on this particular disease? But anyway, it's fine that Mark got us here. He got us covered. And yes, we just want to go straight away to this particular disease. It was, of course, characterized by seizures, convulsions, foaming at the mouth, etc. Yes, and I already gave us a definition of seizures, that they're abnormal synchronous electrical activity that occur in the brain. Now, what causes seizures is what we need to look at right now, so that we know, okay, this patient here, maybe he had this problem, that's why the seizures came, and the seizures, of course, are under this and this diagnosis, things like that. And yes, just looking at seizures and Yeah, the reason as why we cannot say that the disease was actually seizures. Okay, I don't know. I hope I'm pronouncing it right. Yeah, the reason as why we cannot say that this was the disease was this is because a seizure is like a symptom. It's like talking about headache. If someone comes to you and says that they have headache, it does not mean, for example, you've been studying maybe about hypertension. You cannot straight away say that, oh, I think you have hypertension. No, we don't do that. It's not associated to just one disease. It's associated to very many diseases, yes. And for this particular case, seizures are associated to many neurological diseases. And just having looked at the definition of seizures, we'll just go ahead and give the different causes or the underlying issues that actually lead to the manifestation of seizures, because we already said that you cannot connect a seizure to just one thing. You cannot say, since this person has seizures, it means they have epilepsy. We don't do like that. Yes, and of course the number one causes of seizures can be vascular causes, which manifest in form of intracranial hemorrhages and subarachnoid hemorrhages. A hemorrhage is just like bleeding in a cavity. So for this particular case, we're looking at bleeding in any section of the brain that is closer to the cortex. And of course we also have infectious causes, things like meningitis and encephalitis. Meningitis, inflammation of the meninges, and then encephalitis, inflammation of the encephalon. And proceeding ahead, we could also have traumas causing these seizures. And when we talk about traumas, we talk about epidural hematomas and subdural hematomas. Yes, and we could continue and talk about autoimmune diseases like SLE, systemic lupus erythematosus, could also lead to these seizures. We talk about metabolic causes. Now, when it comes to metabolic causes, there are very many. There are different reasons for metabolic causes or metabolic seizures. And this can be due to calcium levels being decreased, magnesium levels being decreased, vitamin levels being decreased, and all. So metabolic causes are really very many. And then the most interesting one, and guys, as I'm mentioning, please try to highlight, try to underline what you think this guy was actually going through. Do you think the cause was vascular? Do you think the cause was infectious? Do you think the cause was traumatic? Or do you think the cause was actually metabolic? Yes, and we also have other causes like idiopathic causes. Yes, idiopathic. By idiopathic we mean like the cause is not known particularly, and just for idiopathic we usually place their epilepsy. Yeah, it could actually be due to epilepsy that these seizures manifested. Yes, and then we also have some kind of drugs. Yeah, prolonged use of some drugs can actually lead to seizures, and of course not seizures that are, for example, that are mentioned in status epilepticus, but the kind of little seizures. And of course, for example, if a patient also has epilepsy, yeah, when the patient has epilepsy and they're under medication, so there's a time when maybe that medication needs to be increased and it's not increased and might actually lead to seizures. And yes, that's the medical or the drug causes, underlying causes due to usage of some drugs. Yes, the last or second last to this all these causes of seizures, we also have idiopathic causes, and this is where epilepsy comes in. Idiopathic means the cause is not really known, like we don't know where it's coming from, but it's there. So under idiopathic causes we actually have epilepsy there, and I think it's under epilepsy that we will dwell so much in the next few minutes. And also just to add, we also have eclampsia, and these are seizures that are usually experienced by mothers or expectant mothers, pregnant mothers that have pre-eclampsia. So with that, of course, definitely we're removing eclampsia, we're removing eclampsia away because this particular young boy was not pregnant, so removing it away, and we might remain with the vascular, infectious, metabolic, traumatic, and idiopathic. Yeah, just to continue. And all right, the reason that's why we looked at the different underlying causes is because we want to look at the pathophysiology of what it does. So basically there are two pathways in our body, the GABA and the glutamate pathway. It means that when all these are triggered, the effect of GABA or the inhibitory effect is going to reduce, and then the excitatory effect of glutamate is going to increase. Now glutamate increasing means a lot of ions are going to enter into the cell, sodium and calcium, all that entering means that the action potential will actually be triggered. And since it's increased, it means that more and more action potential is going to be triggered, and more firing means that more and more seizures will be seen in these particular patients. And yes, that's just the pathophysiology. And then of course, when you look at, of course, I don't know, by the time we've reached this part of the video, it means that we already know that, okay, the underlying factor that we're going to go with in with this little boy is the idiopathic cause. Of course, the idiopathic cause, which was epilepsy that we mentioned earlier. And of course, I'm not going to go into the details of epilepsy because it might not really help us that much. So how would we treat this particular young boy? So first and foremost, we'll have to take blood analysis. Yes, blood analysis, just to check if there was anything infectious, if there was encephalitis, meningitis, any brain abscess and all that. We'd also have to check, would have to do instrumental examination, particularly EEG. Now this one, we just want to see the electrical activity of the brain. How was it functioning? What was really happening there? And all that. And of course, having done that, of course we could do an MRI, but however, the thing about MRI is that it should be done with a contrast and of course a CT scan, etc. And yes, that's it for the instrumental and lab diagnosis. And then for the treatments, definitely would give them anti-epileptic drugs. Yes, anti-epileptic drugs. And how we're going to treat is, of course, for this particular patient, I found it a bit very interesting because, for example, you were not there. I mean, it's not so current, and you maybe did not have the chance of calling an ambulance. So this would mean that you'd have to first check that the airway is actually okay. Yeah, the airway is okay. Check if there is any signs of hypoxia. Check if there are any signs of hypertension, and then just make sure that you put them right, give them enough air and all that. And then of course reverse things like, because we talked about metabolic functions, check that they are not hypoglycemic. Check that of course you could, I don't know how you're going to ask this one, but of course you actually make sure that, okay, this patient is not taking alcohol, because taking alcohol leads to a decrease of vitamin B. So that would mean that you would actually, of course, by the time maybe you brought him to the hospital, check all these factors and check, he's a boy, so there's no need to check if he's pregnant or not, and also check the magnesium levels, check for any history of tuberculosis. And because the thing about tuberculosis, you want to check which kind of drugs was he taking, because this kind of drugs could actually lead to these particular seizures. And also benzodiazepines, these are anti-epileptic drugs that you also want to give these particular patients. And yeah, there are different drugs, and there are different examples during under this particular example. Or yeah, just to continue the treatments, remember we talked about the fact that an action potential is continuously being triggered, and we need to stop this. So we need to increase the action of GABA as well. So you could give them sodium channel blockers, you could give them calcium channel blockers, just to make sure that this action potential is on and under check. Yes. And the reason as why, I mean, why are we talking about the medical aspect of this, is because we just want to relay out the information that, okay, what Jesus actually did was a very important thing. It's not something to be taken lightly, because when we look at epileptic patients nowadays, most of the times the medication that is given to them is a lifelong or for a long term. So they do it, they're constantly monitored under those drugs. And we just want to put it out there that actually what he did, the fact that he right away at the fact that he just mentioned a few words and this boy was well, is not something to take for granted. And in case you're also out there that you maybe have epilepsy and you're believing God for your healing, just keep on believing, and you just know that one day he'll actually grant it to you. Yes. And just in case you also have been under this kind of medications, do not stop, because stopping could actually lead to continuous seizures as well. So you just want to take your medication as well seriously. Guys, that's it for this video. See you in the next video. I hope this was helpful. I hope this was educating, and I hope it was easier than the other videos we've been doing, because yeah, we were able to find out that the patient that was spoken about in the book of Matthew, in the book of Luke, and the book of Mark was actually suffering from epilepsy. Yes, that's our final diagnosis that we're giving the patient. And yeah, see you in my next video. Bye. God bless you.